What will it take to attain universal access to sustainable water, sanitation, and hygiene services by 2030? It is becoming increasingly clear that water, sanitation, and hygiene services are delivered not only through infrastructure, but also through an underlying support system that keeps infrastructure productive and efficient. Systems are the networks of people, organizations, institutions, and resources required to deliver services. Many people, processes, and functions play dynamic roles and have an effect on the level and quality of service delivered.
Water service delivery, for you to have that water coming out of a tap in the rightful quantity and quality that you would appreciate as a user, whether for drinking, for cooking, for domestic use, whatever you need that water for, or to have a proper place for your sanitation, to be able to dispose of hygienically, safely waste, human waste, feces, and also solid waste. All of those cannot come just out of the blue. You need to tackle many parts, many issues, to bring them together for you in order to get those services delivered adequately. So that's what we are talking about, a systems approach, that you need to ensure that the right people have the right rules and regulations that they are following.
Service delivery does not occur in a vacuum. The bureaucratic, social, technical, and financial systems in which service delivery takes place constantly interact with each other and eventually impact on the service delivered.
We are here at this borehole, which is not functioning for over 3 years. The reason why it is not functioning, one, the people around here don't want to contribute towards the repairs of the water source. Secondly, the school itself doesn't have enough money to contribute towards the completion of the repairs, as money is got from the district and their budget is meager. So they can't afford to repair the water source by themselves as a school. Thirdly, when we contacted the sub-county authority, which is Bukuku sub-county, also the budget from the district, that money which is sent for repairs and maintenance, is also very little. So it cannot also maintain the rehabilitation of this borehole.
People also have the finances for you to be able to put up the infrastructure. That infrastructure is also in the adequate, modern, and sufficient means to deliver what you need, either to deliver water or to take away the waste in a safe and manageable manner. You also need the people to be there in terms of people to coordinate these activities. In terms of institutions, like at a district level, we need institution of the district water office. We need institutions of the private sector. We need institutions that are there to coordinate these activities, and each one playing a vital and a very important role.
The key building blocks necessary for the delivery of WASH services include policy and legislation, institutions, planning and budgeting, financing, infrastructure development and management, monitoring systems, regulation, water resources, management, knowledge sharing, learning and adaptation. None works in isolation.
So, whereas government has provided the policies, but the enforcement on the ground has been weak. We hope that with the maybe election of the new LC1 chairpersons at the village level, that the new leaders at the LC1 level can be serious and enforce the bylaws which are there. They need to support us also at the sub-county level with the court system. The laws provide for a court system at the sub-county level to deal with defaulters in the community affairs, but these court systems are also not working well. So all these issues remain pending, and then they create very big operational and maintenance problems.
There are these local policies which they call bylaws. Each village has got its own bylaw, and the sub-county also has some bylaws, and the district has got some bylaws, as ministry has some guidelines. So the community around where there is a very active water source, they have bylaws, and where there is a very active local council system, like the LC1, they have bylaws of whereby they set the amount of money per household to be contributed towards the repairs, and they set bylaws on how the community will come on a certain day to clean around the water sources. So those bylaws are there, but enforcement has been at a low pace, especially from parish chiefs, CDOs, and health assistants.
With regard to financing, we receive transfers at the local government level from the Ministry of Finance that are based on the number of people who are unserved still. So these funds target communities that don't have any water supply, no sanitation facilities, and it's based on that sort of competition with other districts. The districts which have more people unserved get more resources from the Ministry of Finance. These funds are not adequate, they're inadequate because we have challenges of taxation. The taxes again chew into these funds. The cost of materials, construction materials, keeps going up. Just cement alone rose from 25,000 shillings to 40,000 shillings in Kabarole. And we're also importing equipment like the solar systems for pumping water from outside Uganda. So the funds the Ministry of Finance sends is not adequate to the district to ensure that everyone has water. The secondary source of finances is there for the NGOs who are registered at the national level and have been allowed by the Ministry of Water and Environment to operate in Kabarole. These also help us to identify areas where, as a local government, we're not able to reach, and they come in to fund us. A third source of finance is the sub-county level. They have DDEG funds of up to 5 million shillings per sub-county per year, and we have lobbied them through the advocacy meetings to budget for and plan for the repair of non-functioning water sources.
For the person to be able to see water coming out of the tap, for a person to enjoy a proper hygienic environment where sanitation issues are well adequately attended to, it is important that all of these different parts are brought together to work together in order to deliver that kind of service.
Take Kabarore district in Rwenzori region, Western Uganda, for example. Kabarore has a population of 475,000 people, of which 114,000 do not have access to safe water within reach.
Kabarore district water supply coverage stands at 81%, and sanitation coverage stands at 84%, meaning 19% of our households do not have access to a safe water source within a reasonable walking distance from their homes or institutions. We are grappling with the issue of hand washing with soap. We still have a low coverage of around 21%, and so we are embarked on sensitization programs of the communities with support from the NGOs which are operating in Kabarole to show the importance of not only having a functional water source but also using the water correctly, including hand washing with soap at critical times. Latrine coverage is 84%. Most of the households have basic latrine facilities, so we are now also engaged in a program to improve the standards of the latrines, including having permanent floors, having privacy of the latrines, and having a hand washing facility close to the latrine. Yeah, we've also observed in the Kabarore district that whereas some homes have latrines, the practice of open defecation still persists. We have people, especially in the trading centers, who practice open defecation, even with the presence of latrines. So we are handling both the issue of the structures, the infrastructure, but also the change of the mindsets to have 100% sanitation coverage by 2030.
Since 2012, IRC, International Water and Sanitation Center, in partnership with district local government and other actors, has been promoting the system's approach to wash service delivery in Kawarra district. Examples abound for the successful application of the system's approach to wash service delivery in the district, leading to a steady and reliable water supply at the community level.
Because of our limited capacity, that we try to tackle one problem at a time. You cannot first start with a roof, yet if you want a house as a problem to be solved, housing is the problem, you cannot say, for me, I'll only look at the roof. You have to find where to put the roof, you have to find the walls, the ground, the ventilation, and other materials. It has to be a full house for water, sanitation, and hygiene services to be adequately delivered. And as we are being told, by 2030, that nobody should be left behind. Everybody should have adequate access to water and sanitation. It has to be that all the different parts of the system, in terms of adequate infrastructure that is properly managed, in terms of rules to play with, the regulation, the institutions, each functioning to full capacity and each playing in their own role, that adequate finances are also in place, no matter where they come from, whether it is private sector, whether it is a government. And all these efforts were coordinated with a proper monitoring system that will be able to be accountable to the users, that all of these must be put in place.
Yeah, first of all, we have the Ministry of Water and Environment has very good policies, regulations and laws created to ensure that people have access to water and sanitation. Starting with our constitution, it's clear on the roles of the communities, clear on the role of government and partners in provision of good water and sanitation facilities. We have the Water Act, we have the Local Government Act, and are supporting policies at the ministry.
The challenges that we have, like in Kabarole, we are facing some difficulties dealing with these different parts. I think we have adequate legislation and regulation by the central government. The institutions are in place, the district water office, and some infrastructure. But we have infrastructures, some of them have reached their end of design life. They cannot adequately serve a growing population, neither do they have the capacity to meet the needs of ensuring quality water coming out of them, because they have aged and they are inadequate finances to revamp, to overhaul, to change, to build new infrastructure.
One of such functional water supply systems is the Kichwamba Gravity Flow Scheme, serving a major population. The scheme exemplifies proper infrastructure development and management as key to the delivery of reliable water services. Since management of the scheme was taken over by Midwestern Umbrella Organization, clients have continued to enjoy a reliable supply of safe water.
In Kichwamba Gravity Flow, we have to make sure that there is constant water flowing. People have to access water at full time, 24/7. We have to make sure that the water at the source flows up to the reservoir tank, from the reservoir tank to the people, so that the people, they open and take water at any time they want. We make sure that there is water at the reservoir tanks and the pipes are well connected so that people get water. We have to make sure that there is no leakage, which will stop people from accessing water. We repair leakages, we control tap stands so that people open and get water.
In spite of numerous challenges, the gravity flow scheme remains functional because of a wide range of interacting factors. These include water users' willingness to pay for water, presence of a professional scheme manager, an enabling policy and regulatory environment which empowers the umbrella organization, among others.
Right now we have 387 private connections and 58 public tap stands. Out of 58 public tap stands, around 28 are working. Around 28 are working. So the system was for public tap stands. But since there was no control, the illegal connections are there but minimum. We tried to educate those people, the community, that they are not supposed to connect themselves to the water. The right procedures, what they are supposed to do, they are supposed to come at the office of Midwestern Umbrella. They fill the form. After filling the form, we go to the site. We calculate the distance from where water is existing to where water that person wants to put the water. After calculating, we calculate the amount of money for the material which are supposed to be used. Then we take the form to the head office in Chianzozo. They bring the material and the person gets connected after paying. So we have good relationship with the community. First of all, we made some assessment at the beginning. At the beginning, we made sure that we take the correct names of the person who are having tap stands at their home, plus their contacts.
The delivery of WASH services is far more complex and demanding than just the development and management of infrastructure. Where there is a weak link in the system, citizens endure poor quality and unreliable services. The weak links in the system manifest in many ways, including absence of particular policy and legislation for WASH, or where they exist, enforcement is a challenge.
When we came here to assess the problem of this water source, we found out that it needs around 692,000 Uganda shillings to rehabilitate it, and that budget was sent to the district for consideration. But the community here, they feel that this water source belongs to the primary school, and the primary school also thinks that the borehole belongs to the community. So ownership is not yet clear between the two parties now. So members of the Kahasa have been coming down. We wanted to enroll this water source into pay as you fetch, but because the community did not accept the memorandum of send the memorandum of understanding, and the school itself did not want to send the memorandum of understanding, so this borehole did not fall into the pay as you fetch model of service. So it is here and the community is not using it, and there is no alternative, because we do think that the community have got other sources, but we will get information from the community as to where they fetch, because this is not functioning.
I'm Karwange Diga, working with Midwestern Umbrella of Water and Sanitation. We found here a private tap stand here. People, they have been misusing water. We decided to install here a meter so that we can control the misuse of water here. When we installed here a meter, for few days we found here some people come and install this meter. Then we decided to plug off this water.
Inadequate capacity of WASH institutions, which lack the human resources to provide support to service providers and community mobilization activities.
Most of the homes where we have gone, their sanitation is not good. not good. You go there, you find there is a connection here, like a tap, it is around here, and there is a lot of dirt. Animals are staying near the tap, they are defecating near the tap, their sanitation is not good.
The challenge of community contribution towards the repairing of water sources is at large scale, whereby it is contributed by such water points not having water source committees. That is one. Two, the challenge is also contributed by the sub-county authorities also not taking care, not having enough funds to be put on these water sources. So those are the challenges which we are meeting, and it is at all water sources around. Only the gravity flow scheme, which has a water and sanitation board, is the one which has little problems. Where a tap stand has broken down, the water and sanitation board can pull out the money and repair but most of the shallow wells, boreholes in the sub-county are down because the community is not willing. And there is a politicking that water is for free. So people tend to think that water is free, and if it has come from government, therefore it is free.
Inadequate capacity for long-term planning, budgeting and implementation. Insufficient sector funding combined with a local private sector that doesn't adequately invest in WASH.
So we have a huge funding gap at the community level. We think that in Kabarole we can raise 500 million shillings per month from the water users if each household was making a contribution towards its water needs. But because people are mostly taking still free water, there's a very huge funding gap at the district, at the community level. The 51 million shillings we have available at the district from the grant, the conditional grant, is not able to reach all the water facilities in Kabarole, and therefore you get a huge backload of non-functioning water sources.
Unreliable operation and maintenance of water sanitation and hygiene facilities, with delays in repairing broken down sources.
So the mindset of the community is still low. The mindset is still low. The on O&M, operation and maintenance. But we are gearing with IRC to see that we reactivate the water source committees from down up to the water and sanitation board, and that to see that these water facilities are maintained, to see that the environment of the water facility is clean, see that the water source committees are revitalized, and to see that the community itself can know that this investment is ours, they own it, and begin contributing towards the operation and maintenance.
Unreliable monitoring data which mars the planning process. Learning and adaptation characterized by inadequate coordination and alignment, with outputs not readily used for advocacy and policy influencing.
So we are addressing this at the district level first with the meetings of the leaders to share with them what's going on in the field, what's happening in their constituency, and getting them to create their own action plan. What do they think can be prioritized? Is it the stopping the tree cutting? You want to make that priority number one, or would you like to make tree planting, a new program of tree planting, as your priority as a local government? Or do you rather, as a third option, do you rather protect your wetlands first? So the dialogue is going on, experiments are going on to see which tree species will grow in which areas, to see how we can support the communities who are living in near water sources to nurture these trees, to see that the trees mature up to their full life cycle. So we've done water quality testing with the support of IRC Uganda, which revealed actually that many of our water sources here in Kabarole are contaminated because of the bad practices we have around usage of these water systems, and many of them are tied down to water resource management as well, and we're addressing that together with the water users themselves. There are roles that the water user has to play, there are roles the local government has to play, and there are roles also for the national level players. For instance, the Ministry of Water and Environment is now constructing a regional water quality testing laboratory to be the first of its kind in this region to handle issues that are beyond the district and beyond the sub-county as well. The Ministry of Water and Environment, through the Technical Support Unit 6, together with IRS Uganda, both the country office in Kampala and the regional office in Fort Portal, assisted Kabarore to come up with a district investment plan. So we looked at what infrastructure we have now, both functional and non-functional. We looked at the gaps, what are the gaps there in view of some of the people's development needs. The people would like water closer, more water, better quality close at home. And we try to vision and see that by 2030, how much water do people need and where do they want this water. So we came up with an investment plan that shows you the technologies, it shows you the costs involved, and shows you the service levels that we shall have by 2030 to ensure that everyone has good water and sanitation. So we are using this tool, the district investment plan, to guide our investments in the district, to focus what technologies we need to work with and how much money we need as well.
Poor water resources management, characterized by pollution and overexploitation in the face of climate change.
My name is Dennis Maramuzi. I'm the area manager Fort Portal cluster, and Fort Portal cluster covers Chenjojo, covers Fort Portal, basically Kabarore district and Bunyangabo district. And Kabarore district mainly gets water from River Mpanga, which is where we are standing now, and it supplies it to different areas up to Chijura. We are planning to take it to Kabende, supplies it along Kasese Road, supplies it along Ugamba Road, and we are planning to take it to Karago. You know, the biggest challenge we have had here at the obstruction point is when it rains up the stream, we end up getting maram instead of water. Now, if we have a heavy downpour in Karangura there up the stream, what we expect is that we are going to have maram, and we will switch off the plant for 2 hours for the maram to clear. Because at the end of the day, it becomes too costly to treat that maram. The dirty water that we get, we try as much as possible to treat it, but when it's beyond a certain point, it becomes somehow hard to treat.
Perhaps the weakest link identified in Kabarore district is the weak implementation and enforcement of legislation and policies relating to water and sanitation service delivery. Many stakeholders in the district argue that the wash service delivery systems should be strengthened and enforced.
Pertaining this protection of this river, and we told them, of course, it is 100 meters sideways. That one is a river, I would call it a buffer zone for the river. It is not supposed to be affected by any human activity. We held that meeting, though it was not all that successful. You know how people stage conflict since they have been earning a living in this particular river. But that meeting was held. After that meeting, we went on calling LC1s also again. What should we do as leaders? Should we wait this river to again flood and demolish some homesteads? Finally, we came up with a venture that we should plant trees.
To strengthen wash systems, IRC and partners has introduced a number of approaches, including the development of a district wash master plan and the formation of the district wash task team.
To bring all these different parts together must be well addressed. I think for a long time we have not had such comprehensive plans that tackles issues of how we are going to do monitoring, of how we are going to coordinate efforts and resources, of how we are going to ensure that water resources, where we are drawing all this water, is well maintained in terms of practicing adequate integrated water resources management. In terms of the infrastructure, yes, we are saying the infrastructure is old, but was there a plan in the first place? Is there a comprehensive plan that can tell you how many infrastructures do we have and at what point do we need to service them, to repair them, to revamp them, to overhaul and install new things? So that's why for IRC we have felt that it will not be possible, it will remain a dream, a desire, unless we sit down with all the stakeholders, look at all these different parts that make up a wash system, a wash service delivery system, that we come up with a comprehensive plan, which we are calling the District Wash Master Plan, that will adequately lay out how we are going to tackle all of these different parts and probably deliver full coverage of water, sanitation and hygiene by 2030.
The District Wash Master Plan provides a framework for planning, coordinating, and guiding the implementation of water sanitation and hygiene service delivery. The plan articulates the long-term priorities of the district.
Yeah, in order to attain SDG 6, the local government has invested a huge amount of resources since the turn of decentralization in 2000 up to now, 18 years down the road. A good asset management way of doing things is that we need to keep track of these assets that are put in place. Water assets are mostly under the ground because the water most times is under the ground. So with time, we lose track of some of these facilities that have been put in place by our partners and by the local government. So in Kabarole, one thing that we've identified to help us with asset management is the need to have useful data on our water and sanitation facilities. So we need to collect data correctly. We need to interpret this data correctly as well in a timely manner to inform the future investments. Data is one of the useful links in asset management. The use of the water, what we use this water for, how much we abstract from the environment, and after using it, where we dispose of this water is also something important in Kabarole. We've observed a lot of degradation of the water sources. The Ministry of Water and Environment has come up with water source protection guidelines that our service providers are supposed to use in managing these assets, in running these systems on a day-to-day basis, to ensure that this generation, the future generation, finds this water in place.
The District Wash Task Team comprises 15 members representing all sectors that interact with wash systems. The task team mainly does advocacy and steers progress towards the attainment of universal access to water, sanitation and hygiene services in Kabarole District.
Yeah, I think Kabarole is on course to achieve SDG 6 because we know we have a good network of the partners here working together well. We have a common vision. We all want the people to have good water and sanitation. We are following the same methodologies to implement water and sanitation in the district. We've cut down on redundancies. We do not do duplication. We've allocated geographically the areas for the partners to work with. So going forward, I think that we need to have good leadership at the village level, mostly, because all this happens in the villages. Yeah, all these systems are constructed in the villages, the water is used in the villages, the environment is degraded in the villages. Leadership governance is crucial. We need to work on the governance issues to ensure that whatever resources invested in the water and sanitation sector here in Kabarole yields a good result as well. That's step number one. Yeah. Then step number two, we need to not only look at SDG 6 in isolation, we need to bring in especially the first 5 SDGs. We need to fight poverty, we need to fight hunger, we need to look at the health. We need to link SDG 3 with SDG 6. Yeah, and also the involvement of gender aspects. What are the roles of women and men with regards to the management of the water facilities in Kabarole. These first 5 SDGs, we need to integrate them in our project proposals for SDG 6 here in Kabarole, to create a link between, let's say, health and wealth, to demonstrate that a good community, a healthy community in Kabarole will then become wealthy in future, to attract investments, to attract the people to participate in these programs as well.
It is important to acknowledge that oftentimes the system may not function perfectly. Many of the building blocks overlap. Depending on the time and context, some building blocks may be more important than others. But the core element of systems strengthening is that for WASH systems to be delivered, all building blocks must be present and working to at least a minimum level.